And
Right.
what's regional anesthesiology?
So regional anesthesiology is essentially the technique of doing a nerve block, which means you inject numbing medicine close to a nerve to essentially turn that nerve off so a part of the body cannot feel pain, whether that be the arm, the leg, the trunk, the stomach.
Most people heard of epidurals for delivering
Right.
a baby, for
Right.
example.
This epidural is one modality we use, spinal block. For Dr. Perlmutter's surgeries, because he does the majority of his surgeries on the arm, the elbow, and the hand, it's very convenient that we can do a nerve block procedure to numb the entire arm.
And we're actually going to show him doing a nerve block on our second segment.
Now, if you block my arms so I can't feel anything, then am I awake the whole time?
No, you're still asleep and sedated, but the difference is we're able to make you comfortable and sleep with much less medication and not have to interfere with your breathing.
So the patient breathes on their own.
Breathe on their own, just like when you're sleeping at night. A comparison would be a general anesthetic, which would be someone being completely asleep and unconscious. We would have to breathe for them. With regional anesthesia or nerve block anesthesia, like we do for the majority of Dr. Perlmutter's cases, the patient has an essentially numb arm and just enough sedation to make them unaware of the surroundings and sleep just like they're sleeping at night with a natural airway with no instruments in the airway.
That's what they call light sedation?
Moderate sedation is typically the level that we use for the nerve blocks and for Dr. Perlmutter's
Yeah, I
surgeries.
really like that you said in the beginning that you are right there for people because they're scared, because people are scared. If they're going to lose control of themselves, they are unconscious. And that's scary to me.
It is scary. I mean, having undergone hand surgery myself a couple years ago by a wonderful surgeon, and even though I was surrounded by my friends and people I trust, when you're laying on that gurney and you're on the other side of the curtain, you are intimidated. You are scared. Just a human response.
And I love that you acknowledge that you know when you're working with people, you have that mindset that, you know, I'm going to make you feel the best I can, that I really, really care about you and you can trust me.
It's important. We don't tell people, oh, and placate them and say, oh, don't worry about it, you'll be fine. We acknowledge their fear. We tell them that it's a normal thing, and this is how we're going to work through it.
Good.
You know?
I always tell my patients, I've had 3 surgeries since I've been an anesthesiologist, and every single one of them I have been anxious because it's a normal human emotion and reaction.
Will I wake up? I mean, that type of thing. Yeah.
But then, you know, I was well taken care of, and my fears were alleviated and anxieties were alleviated. So that's what we will provide for our patients here
Good.
at Nash.
And then the transition from getting some medicine that makes you sleepy to going to the operating room and you actually get some medicines that may make you forget that you even were in the operating room. And then having your arm numbed up or your leg numbed up, not feeling any pain, having your procedure done, being taken to the recovery room, waking up slowly in the recovery room. Nobody startles you to wake up. You just wake up when you wake up. But when you wake up, you still have a numb arm or a leg, right? And still no pain. And it was a very comfortable experience, and your fears are allayed.